Good afternoon, everyone. Thank you so much for joining us. Today I'm sitting down with Democrat Congressman Bera of California, who serves on the House AI Task Force, along with Kev Coleman, a research fellow with Paragon Health Institute, and then Brian Anderson, the co-founder and CEO of the Coalition for Health AI. And we are going to discuss artificial intelligence and the healthcare space and all the work that needs to be done in order to make this a safe endeavor. So the future is now. I'm sure everybody in the audience already knows. AI is upon us. Health systems are using it. There are very few guardrails, and there is not even really industry consensus on what those guardrails should be. Congressman Bera, you are a member of the House AI Task Force, and your task force issued a report that sort of looked broadly at the industry. It wasn't focused on healthcare, though you did look at sort of the implications for healthcare. And the report highlights a lot of ways in which AI could be beneficial, but also the risks. The most bipartisan takeaway seemed to be that this is something that we need to be investing in, right? And that includes, in fact, I have a quote here. I'll just quote from it. Sustained strategic investments in research and development will be critical to maintaining U.S. leadership in AI from the NIH and others. And so given the priorities on cutting the federal budget, I'm curious, where will this investment come from?
So first off, thank you for having me here. I think Speaker Johnson and Leader Jeffries were prescient in creating the task force, equal numbers of Democrats and Republicans, and it was pretty nonpartisan, which is hard to say in D.C. these days. Congress can appropriate those dollars, right? I mean, we have to, because we know AI is coming at us. And so we made recommendations. We created a framework. We hope that we'll create a select subcommittee, because what we worry about most is 50 states doing 50 different pieces of regulation. That would be a disaster. I'm a Californian. We were able to stop some of the California, and it was thoughtful legislation, but again, we think Congress should put in those guardrails to provide safeguards, but not to stifle innovation. And we think there's an urgency there.
To do it. And so you think that even though there is sort of this pressure to cut costs, and even there has been cuts to research investment, that you can still make those dollars?
Absolutely. Yeah. I mean, the dollars are going to come out of the private sector as well, but it's our job as Congress, right, to put up those guardrails. We were slow to the game in social media, and it's really hard to put up those guardrails today. We can't make that same mistake, and we see how quickly AI is evolving.
So another big question in industry and that government is grappling with is how do we ensure that AI in healthcare can be safe? And the FDA, the Food and Drug Administration, has provided some guidance on this front, but AI is really different than sort of what they have regulated in the past. It changes, it can degrade, it is adaptive. And there's a lot of concern about how to monitor and ensure that this technology is safe after it has been authorized. Former FDA Commissioner Robert Califf has talked about this. He said that the agency needed more staff to do this, and that Congress should either clarify or potentially expand the FDA's authorities in order to do more monitoring once that technology has been released. And so I'm curious, given the report, which did mention this as well, that this is something that Congress should look into. What is the consensus so far among your colleagues?
Yeah, so, talking to industry and the way we approached on the healthcare side is we put out a request for information, how folks were thinking about it. We got a lot of really interesting insight. I think we did reach a conclusion that the FDA had the authorities that they needed on the front end, but as you pointed out, AI is different, right? So an algorithm that you might approve as safe and effective today, in generative AI, it's learning and so forth, and a year from now, that may be a very different algorithm, and the FDA is probably not equipped to say, okay, let's go back a year from now. So we've got to figure that. I don't think we'll let industry self-certify, but what's that middle ground where the FDA can do the initial approvals, but then again, as these algorithms change over time, they'll be different a year from now, 2 years from now. I don't think we have an answer to that question just yet.
Yes. Though, luckily, on this panel, we have two guys here who have some ideas about this. So, Brian, would you talk a little bit about how the Coalition for Health AI wants to approach this problem of post-market surveillance?
So, first, it's a huge problem. And Commissioner Califf, Commissioner Gottlieb, and others that have spoken about this blind spot with the FDA are exactly right on. In CHI, what we're trying to do is bring together a broad group of health systems that are interested in essentially standing up this kind of post-deployment monitoring capability. Because right now we don't have that in AI, right? You look across the different regulatory areas that the FDA approves, be it drugs, devices, vaccines, other areas, there are post-market deployment surveillance networks. We don't have that in AI. So in CHI, what we're doing, again, industry-led effort, where you have vendors working alongside health systems wanting to understand in the local environments, in the health systems, where these models are deployed, how they're actually performing. We don't have that kind of hard data yet. And so in CHI, we announced this nationwide registry several months ago. The point, or one of the main efforts is going to be to create a space transparently available to the public where health systems can share how these models are actually performing in their local environments. And we can learn something from that, right? If you have a sepsis model, the same kind of sepsis model that's deployed across 10 or 15 health systems, understanding how that model performs in each of those local environments and where there might be differences in that performance, we'll learn a lot from that. And so that's part of the process that we're trying to stand up, is that kind of transparency and that kind of shared understanding of how these models perform.
Okay, great. Now, Kev, you also put out a report on this idea, and in particular, you think that the FDA plays a pretty strong role in this, and so I would love for you to talk a bit about that.
Certainly. The FDA has a long precedent of evaluating and reviewing software as a medical device, and this applies equally to AI whenever it's being used in the treatment, prevention of disease, et cetera. However, these models of review in the FDA originated within the world of mechanical devices and deterministic software. And what we now have with AI is certain forms of technology that may exhibit at times unpredictability. Now, unpredictability is not necessarily a bad thing. It actually could be quite beneficial. When we talk about unpredictability, I don't necessarily know in a test bed a future outcome. Well, that sounds, threatening with something like generative AI, doing some type of verbal output to you. However, what about a probabilistic adaptive system that's going to improve its diagnostic accuracy over time? And this is where I think there's a profound opportunity for a public-private partnership, one that leverages the collective self-interests of developers, of health systems, of insurance carriers, and even some of the major infrastructure vendors within the EHR space. Currently, I've drafted or co-authored a paper with Dr. Michael Pensino over at Duke University, the head of Health AI over there, and we're going to be dealing with a targeted post-market surveillance model that doesn't just randomly increase the costs of AI, but tries to introduce a non-disruptive model that can make sure that AI flourishes as a national concern while at the same time addressing some of the legitimate safety concerns that the technology evidences.
But do you think specifically that the FDA does need some expansion of its current authorities to play its role?
Given what I've seen of FDA authority, they seem to have what they need. I have heard that statement claiming that they don't have authority. That seems to be more of an issue of agency-specific regulation than necessarily new legislation. Now, if someone could show me a deficit within a specific a law, I'm happy to review that. But at least at this point, I haven't seen those deficits that's being spoken of.
Did you want to add to this, please?
Yeah, I mean, I'd agree with that. I think they've got the authorities. How they interpret and utilize those authorities, they may have to modernize. But I think our sense is they've got the authorities to do what they already do fairly well to this new technology.
I absolutely agree.
So which then means we're sort of talking about clarifying what they do in order to sort of meet the moment.
Yeah, I think adaptation, and I'd love to hear both the representatives' opinions as well as Brian's, but you know, an FDA as a oversight agency is constantly having to evolve to the material realities of the marketplace. This is just one more instance of this. That's a complicated instance. You know, you have to get into things like, you know, what's a, you know, deterministic, you know, algorithm, you know, versus a non-deterministic one. How do you deal with training data characterization and the implications for, you know, outcome uncertainty? Okay, that's complicated, but that's all seems to be within their wheelhouse.
Well, and part of the reason I even bring up the FDA at all, I mean, it is their job historically to regulate these technologies within medicine, but you know, one of the reasons that people talk about whether or not the FDA has enough authority is because I think there is some concern about an industry-led model and creating too much room for regulatory capture, which we're going to come back to.
Right.
But first, I wanted to ask you, so what is the potential for Congress to pass a bill that would sort of clarify FDA's role in post-market surveillance?
Yeah, so again, I don't know if it's a new piece of legislation per se or just working with the administration in that capacity. Congress isn't a highly functional body right now, so I'm not sure that legislation's going to have legs. But I think, again, we could work with the administration in this particular context to, you know, provide that guidance, provide those definitions. But there's still real big questions left out there, right? Because, again, these are, I think, the FDA has everything it needs to do initial approvals, but what's that ongoing approval look like?
And Representative, would you also feel that there's a great need of clarification, at least at the public level, regarding healthcare domains? You know, we talk about healthcare regulation, but they don't necessarily understand that within healthcare, you actually have a bunch of subsectors that need to be treated separately. You know, AI within a front office appointment setting context is much different than within a clinical setting, which is much different than within claims adjudication versus an insurance company dealing with prior authorization. And I get very worried when people want to lump all those things together, because it can lead to a profound amount of inefficiencies and also adding a lot of incremental expense within an already profoundly expensive American health system. I will just say for myself, one of my greatest concerns as a researcher is the amount of money that we expend as a nation on health care. You know, we're now up to, what, 17.6% of the gross domestic product, up from 17.3 the last reporting period. That 3.3 to 0.6, that's hundreds of billions of dollars. We need to be able to find ways to leverage AI to maintain and improve quality standards, but most importantly, reduce the cost of healthcare delivery. You know, you cannot reduce insurance premiums unless you actually reduce healthcare delivery costs.
100%. I mean, I think that is something Congress can do. Can we put the incentives in the right place? Can we incentivize innovation? One thing we worry about, and you know, Robert's group is doing great work in terms of collecting the information, and we're in a benevolent phase where big health systems, folks that are already doing stuff, are sharing that information. But at some point, let's say, you know, a big health system that comes up with an algorithm that reduces hospital length of stay by 2 days, they're going to realize they've got a competitive advantage in the marketplace. And I worry about the day where they're not sharing their findings and algorithms as freely. It's not happening right now. Again, there's a benevolence and a sharing, and I worry about that.
I'm so glad that you are all talking about cost. So in terms of ensuring that AI is safe, which is sort of the bigger, broader point here, federal government, not a lot of rules around AI. FDA has its remit, has issued some guidance, is working with players, but there's stuff that's not under its remit. You have erected your organization to be a part of this, but also there are several other organizations that are putting out standards now that are erecting their own certifications. Those certifications cost money. There is concern that whether it's health systems or AI product makers are going to have to pay to get certified by CHI, but then they're also going to have to pay to go through the FDA process. And who ultimately pays that price? Where does that money go, right? So that, you know, there's a potential here to to inflate healthcare costs. So how do we handle that?
Would you like to speak first?
Yeah, I'm happy to give some thoughts onto this. So, this is something we were actually speaking with a few of the senators yesterday up on Capitol Hill about. I think one of the greatest hopes about AI is driving down costs, as you're describing, Ruth. And, I'll readily admit that probably the biggest driver of cost in healthcare is physicians. I'm one of them. I can say that. We're the biggest, most expensive cost point of labor. Part of the hope with AI, and particularly in the agentic AI future, is the ability to drive down costs by taking on some of that work that physicians spend a lot of their time doing, adjusting medication prescription, looking at the blood sugar levels for a diabetic patient or the blood pressure levels for a hypertensive patient. When you have AI tools that are created safely and effectively, that have the right kind of guardrails around them, there's real opportunity if we have a focused effort and looking at things like value-based care areas, be it with Medicare Advantage or Medicaid or within CMMI, to demonstrate how these tools can drive down cost and not just create another procedure code to bill for in a fee-for-service world. I think that those are the areas to focus on being able to realize that potential benefit that we all want with AI tools.
And can we get the money to do those pilots, I think is a question.
Yeah, I think we can, and I think a lot of that's already happening. I think about the amount of healthcare data that my Apple Watch is collecting. Mm-hmm. How do we use AI to sort through that data to make me, as a physician, a better physician, but also to reduce the cost of care? I mean, it's all there, so we can do this.
Can I just share? I think one of the things additionally is this concept of AI governance. Mm-hmm. Health systems are just struggling with this. So we have over 200 plus health systems in CHI, and nearly every single one that we talk to describes almost an existential concern where we've jumped into this AI game, we've procured these models, and now we realize, just as you're describing, they drift, they adapt, they're dynamic. How do we monitor? How do we manage them? So being able to bring together the health systems of America to identify what are the scalable ways towards AI governance and monitoring, and partner with them to help them deploy that in a financially sustainable way, that's one of the key areas that we're focusing on, Chai. If we don't get that right, there's going to be a lot of health systems that simply can't get into the AI game, and that's what we don't want.
I'm glad you brought up AI governance. So one thing that CHI has done is to create the registry. You've done that in partnership with a company called Avanade. For those who are not familiar with Avanade, it's a spin-out of Microsoft. And so Microsoft is going to be essentially a big player here. I do wonder, and I'm not the only one, representatives within our Congress, Representative Olber, Nolte, and several others, have raised concerns about sort of some of CHI's work, just insofar as it does create that opportunity for a big company like Microsoft to capture the market. Congressman Bera, how are you and your colleagues thinking about that issue?
I mean, so again, first, hopefully, we reinstitute the select subcommittee, because the more questions we ask, the more questions that come up. And I do think this has to be a public-private partnership, because we're actually working with industry to get this right. And I don't have the answer exactly what that would look like, because AI is going to be a powerful tool to both improve outcomes, lower costs, reduce the administrative burden on physicians, make us better clinicians, and enhance our lives. But if those guardrails aren't up, it could also be used to drive profit, to reduce care, we've seen instances where health plans are using it on the prior authorization process in a negative way to deny care. So I think that is why we feel like we've got to get guardrails up, not to stifle innovation, but also to prevent the bad things from happening.
Can
yes,
I respond
please,
to that?
By all means.
So, I mean, it's a fair concern. Anytime you have a not-for-profit that's stood up and is trying to be as inclusive as we can be, that you don't want any one organization to have undue influence. Microsoft is a big organization, right? And so in CHI, we've tried to have a big tent approach. So all of the big tech companies are part of CHI. But also part of CHI, those 3,000 organizations, over 25% of our members are startups with less than 50 employees. And we have a set of governance structures in place that are attempting to ensure that there is no outsized influence by any one member. And so a lot of the work we do, building these industry consensus guidelines and best practice frameworks, is driven by the startups that we have. It's not driven by organizations like Microsoft or Google or Amazon. We really make an intentional effort to try to include the investor community, venture capitalists, private equity firms, as well as all the startups that they represent. And so, I think there's a lot of misunderstanding that when you have big tech organizations with really recognizable names, it's like, oh, somehow, Chai is a cabal of these kinds of organizations. It's absolutely not. The most active members in our community by far are the startups and the health systems. You have startups that want to build trust with their customers, and you have health systems that want to use the most innovative technologies, be it ambient listening technologies from any of the kinds of startups that are out there. And in Chai, we are building those frameworks that enable that kind of trust to exist and to flourish, along with a set of guidelines for safety and efficacy.
Yes, I will push back on that only slightly to say the platform that you're partnering with, Safe AI Governance, they also have great ambitions to not only be a registry, right, which is what they're doing now, but they also want to do that post-market surveillance. And, there are a lot of incentives for health systems to all get on the same platform. So that's why I'm throwing that out as a consideration. Kev, jump in, please.
Oh, certainly. The issue you're bringing up around AI governance is enormously important, and I would never want to dismiss the concerns about regulatory capture, et cetera. I think the larger issue, taking a step back as a former startup executive, having worked within the Silicon Valley model, et cetera, is a point that Brian brought up earlier, which is financial sustainability. AI systems ultimately have to be purchased by healthcare systems. And if you have any type of certification process that is largely duplicative of the FDA and also requiring a highly consultative model of informatics specialists, I don't think that's going to survive. I will just tell you that's not a model that I think is sustainable. I think this idea of being able to disseminate standards and facilitate and empower is going to have the day. And I think what you're going to see is a lot of localization around health systems that have a shared AI implementation, being able to share metadata as opposed to private health information to be able to deal with some of this post-market surveillance issues. Though one of my great hopes is that aside from AI governance, aside from all this, is that we actually take a step back and think about the full potential of AI within healthcare. And I would love to see a moonshot initiative where we actually try and take our, tackle our healthcare costs and say, okay, look at the very expensive labor that we've talked about and find ways where we can safely, reduce labor costs through the use of incredibly powerful artificial intelligence. That's exciting, and that's something that will just benefit people on both sides of the aisle. Everyone is being crushed by healthcare costs.
Well, I am at time. Thank you all so much for your time and expertise. We hope to continue this conversation as more changes arise and the technology rapidly develops in the coming years. Next up, join Politico's Sophie Gardner for a conversation on the future of public health and preparedness with Dr. Vanessa Carey of the World Health Organization.